We all know smoking is dangerous. What you might not know is that for decades, the tobacco industry used different marketing tactics in different communities. The result? Some communities have been hit much harder by smoking related illness. April is National Minority Health Month, and today we're talking about why that happened and where to find free help to stop for good. Let's welcome Dr. Kendrick D'Artisse, Vice President of Outreach and Engagement at Truth Initiative. Good to have you. Thanks so much for joining us.
Glad to be here.
Yes. Okay. So first off, I wanted to ask you, how has the tobacco industry historically targeted Black communities, and how is that still affecting people of color today?
Yeah, absolutely. The tobacco industry has continuously, for generations, really targeted the Black community by inundating ads of neighborhoods in regards to sponsoring jazz and hip hop festivals. We've all seen those, and we really have been able to really take an opportunity to really address those here at Truth Initiative, and really spotlight on the work they're doing to be able to really disproportionately affect and market to African American communities.
Yeah, and hearing about how people have been targeted, I also want to talk about the addiction patterns. How does
Yeah.
menthol specifically impact nicotine addiction?
Yeah, absolutely. Menthol is easy to start and hard to quit. And so we understand that here at Truth Initiative. We know that also we have 72,000 people are diagnosed with tobacco related cancers. We have 45,000 Black Americans die each and every year from smoking related diseases, and as well as 20,000 particularly around secondhand smoke exposure. And so we know those are staggering figures, and really African Americans really have disproportionately effects in regards to their health outcomes. And so we have been doing work at Truth Initiatives, really spotlight and really create opportunities and programs to really address the disparity head on through our amazing X program that we developed with the Mayo Clinic.
And Dr. D'Artisse, are there trends that you're seeing in terms of tobacco and nicotine use among young people specifically?
Yeah, of course. We see Zen nicotine pouches, particularly, are as a significant increase in regards to usage, as well as hookah in our African American and Latino communities. It relates to regards to individual usage and socialization of tobacco products, and then as well as we know vaping is a problem and really has created really a lot of effects since its early days, and so we've really been addressing those through our amazing campaigns and ads, as well as creating a really intuitive way to engage those audiences and users, being able to get them to quit through our amazing X program.
And when people are considering quitting, what barriers exist when it comes to accessing quitting resources, and why is culturally relevant outreach critical when it comes to helping people quit?
Yeah, absolutely. So we know that each community receives information, particularly health information, differently. And so what we do at Truth Initiative is really create tailored programming for those audiences, the Black community, the Latino community, and the LGBTQ plus community, as it relates to how we are able to really address the disparity head on through really cultural ways. We know some of the aspects of tobacco cessation really is around. We know that lozenges and gums and patches are preventative nicotine replacement therapies. We also know that there is a overall cost to that. So we have a free program here at Truth Initiative called the X program that helps people in being able to do really address their addiction head on through our 8-week program.
Okay, and yes, please walk us through the X program and how it works, what makes it effective, and how does it differ from other quitting tools?
Yeah, so our digital free cessation treatment program called the X program, we developed this quite some time ago with the Mayo Clinic, and we've been revamping and energizing it for the new generation that are addicted to nicotine products. And so the X program, you can look at information at join.xprogram.com. And so we're able to really look at the things that are need and triggers for your day-to-day life. And so it's a text message that comes to your phone that is basically, your friend in your pocket that really helps you address the disparity and really, okay, I need to stop quitting, because there's a piece of it that you are able to really address directly around your individual addiction. So if you wake up every morning and you're reaching for the vape, that you are telling your X program, your partner on your phone, like, hey, I wake up every morning and I'm really using a vape product. I need, to redirect my energy. And so the X program helps you and guides you along a way. And we've seen that our program has really done extremely well with this audience, and really being able to really address the need head on.
Yeah, well, it's great to hear that those resources are being made available. Dr. Dartiz, thank you so much for joining us. I'm going to let our viewers know how they can get more information. Break the smoking habit with culturally relevant care. You can find out about the X program at xprogram.com and learn more about the steps to quit smoking at truthinitiative.org/outsmart-nicotine.